Hello everyone. Welcome to Cure Concept Homeopathy. If you are a BHMS student and you have ever felt confused while studying Materia medicine, like we study hundreds of remedies, thousands of symptoms, but when a clinical case comes in front of us, which medicine should we actually pursue? Then this video is exactly for you. On this channel, we are not going to study homeopathy by simple mugging up. We will understand concept, we will connect theory with clinical practice, and we will simplify difficult topics into practical understanding, especially for BHMS university exams and clinical applications. So, in today's very first introductory video, we are going to understand what exactly is homeopathic therapeutics, why therapeutics is important, how to write therapeutics, answer in exams, and how therapeutics help us transform disease diagnosis into individualized remedies. After studying hundreds of remedies in Materia Medica, one very important question always remains. Which medicine should we actually prescribe in a real clinical case? That exact bridge theory and practical prescribing. It's called homeopathic therapy. How to write homeopathic therapeutics? Homeopathic therapeutics is the practical and systemic application of individualized homeopathic medicine in disease management. In simple words, it teaches us how to convert theoretical remedies into actual clinical prescription. It is not only about knowing remedies, it is about knowing when, where, why, how to prescribe. We memorize hundreds of medicine materia medica, along with symptoms, modality, mind pictures, and constitution. But during exam and clinical practice, a difficult question appears. Which remedy should be selected for particular disease condition? Therapeutics acts like a clinical filter. It helps us understand which remedy is fully indicated, where the remedy acts most effectively, and why that decision becomes scientifically and clinically justified. What is homeopathic therapeutics? Homeopathic therapeutics can be defined as the practical and systemic application of individualized homeopathic remedy in a clinical disease. It is the meeting point where theoretical materia medica joins hands with practical clinical experience. Without therapeutics, materia medica remains theoretical. And without materia medica, therapeutics loses its foundation. Now, origin of therapeutics. The term therapy is derived from the word therapy. It represents the active process of treatment and cure. Therapeutics mainly focus on three important zones. Scientific treatment, meaning a planned and structured approach to patient care. Second one is disease management, meaning proper handling of disease progression and restoration of health, meaning bringing the patient back to a balanced, healthy state. Disease management scope. Disease management in homeopathic therapeutics include multiple clinical responsibilities. First comes the diagnostic phase, where symptoms, case history, and investigation are carefully analyzed to identify the pathology. Second comes care and advice, which includes diet regulation, hygienic guidance, and removal of obstacle to cure. And finally, action study, where the physician decides whether the case requires curative treatment, palliation, or even surgical removal. Applied materia medica. Therapeutics transform materia medica into applied clinical understanding. Instead of studying one remedy from beginning to end, therapeutics studies disease condition and compares multiple remedies together. For example, in pneumonia, fever, arthritis, or dysmenorrhea, therapeutics allow side-by-side comparison of important medicines. This comparative method improves differential remedy selection and practical prescribing. Let us understand with a simple example. In fever, belladonna is often indicated in sudden high fever with throbbing. Aconite becomes important after exposure to cold, dry wind with anxiety and restlessness. Decemium is useful when fever is associated with dullness, dizziness, and drowsiness. Now, in dysmenorrhea, magnesium force is known for cramping pain relieved by warmth and pressure. Sepia is associated with tearing down pelvic sensation. Chamomilla is useful in irritable patients with severe cramping. So, even though the disease name is same, different patients require different remedies. This is the essence of individualized. Successful therapeutics depend upon proper diagnosis. The first pillar in history telling, where the physician study onset, position, modalities, and progression of symptoms. Second is examination, which includes objective science, physical findings, and systemic techniques. And third is investigation, such as blood tests, imaging, X-ray, and ultrasound. Together, these three pillars create a complete clinical picture. The diagnostic. The diagnostic triad includes three levels. First, nosological diagnosis. The, these identify the exact clinical disease according to modern medical standards. Second is differential diagnosis. This distinguishes the disease from other similar conditions. And third, remedial diagnosis. This converts clinical findings and individualizing symptoms into final homeopathic simile. Now, exam long answer strategy. In examination, therapeutics answer should follow systemic structure. Start with definition, then disease cause and etiology. After that, explain clinical feature, sign and symptoms, mention diagnostic criteria and differential diagnosis. Then describe management, including general management and homeopathic management. After that, mention important group remedy, and finally conclude with remedial diagnosis and remedy differentiation. Remedy discussion framework. When discussing any remedy in therapeutics, a proper framework should always be followed. So, explain what type of therapy the remedy represents. Mention which disease condition are covered, characteristics, nature of symptoms, discuss important concomitants if present, then mention keynote, especially mental symptoms, also include constitutional tendency and general modalities. These method create complete and highly quality therapeutic answer. Therapeutics in clinical subject. Therapeutics become highly important during clinical subject in BHMS. In third BHMS, it is applied in surgery, obstetric and gynecology. In final BHMS, it becomes essential in practice of medicine. Therapeutics improve clinical understanding, remedy differentiation, and practical prescribing ability. Therapeutic approach are there. Homeopathic therapeutics can be divided into four major approaches: specific therapy, constitutional therapy, curative therapy, and palliative therapy. Each approach has a different purpose according to condition of the patient. Specific therapy. Specific therapeutics focus on immediate symptom relief during acute condition. It is highly useful in emergencies and certain illness. Prescriptions are based mainly on present active symptoms. Common examples include acute fever, acute pain, inflammation, or bleeding. Constitutional therapy. Constitutional therapeutics goes much deeper. It does not only treat isolated organs, it treats the entire person. Selection depends upon physical constitutional, mental state, miasmatic background, and general tendency. It is especially useful in chronic, long-standing. Its goal is correction of patient basic constitutional weakness. Curative therapy. Curative therapeutics aims at permanent restoration of health. It works on deep susceptibility and functional disturbance. The objective is not temporary suppression, but complete recovery by stimulating the body's natural healing power. To true cure, always attempt to restore harmony at the deepest. Palliative therapy. Palliative therapy is used when complete cure becomes impossible. This usually occurs in advanced irreversible pathological conditions. In such cases, the focus shifts towards pain relief, comfort, reduction of suffering, and improvement of quality of life. Now, understanding disease. Every physician must understand disease phase properly. Acute disease appears suddenly and require rapid symptomatic management. Chronic disease develops slowly and require deep constitutional treatment. Similarly, mild condition may respond to gentle remedy, moderate potencies, but severe pathological state demand careful remedy selection, potency planning, and repetition stability. Core message about this video is homeopathic therapeutics is not simply memorizing list of remedies for different diseases. It is understanding the disease, understanding the patient, and selecting the true simile. So, if you generally want to understand homeopathy clinically, not just memorize it theoretically, then this channel is for you. Make sure to subscribe Cure Concept Homeopathy and join this learning journey with us. Learn, understand, apply, and heal. Thank you for watching.